8 is fine. So the way that we use this, so it complements both the restorative and the surgical, is we do a dual scan technique. Basically, we scan the patient wearing the radiographic guide, and you can see in the image that the only radiopaque substance in the radiographic guide are the 6 gutta-percha markers. So when you scan the patient, you're only going to see the gutta-percha markers, as we see here. But the second scan is of the radiographic guide only. And the reason we're able to pick up a digital duplicate of the radiographic guide without any barium or any type of radiopaque substance is because we scan it alone. We actually set it on a piece of foam so it looks like it's floating in the gantry. And the scan will pick up a density comparative to the surrounding densities. And since there's no surrounding densities, it's able to pick it up and scan this image. It just can't. It's got to be by itself. So the common denominator between the two images is those radiopaque substance, those gutta-percha markers. And so we just merge those two together. And the nice thing about this is there's no radiopaque effect on the bone, especially in the surgical area. So you're going to see the bone really clearly. But also, if we build your radiographic guide so it's proper ideal tooth locations, then you don't need to see the opposing arcs. You just use the guide as your ideal tooth location. So restoratively, it's really great that way. Okay, so let's review the entire process. This is the radiographic guide process. If you use it on every patient, you'll be able to get a surgical guide. The stone model and the DICOM only you may not be able to use on every patient. So basically, if you take a VPS PVS impression, you send it to us or a dental lab, and they build a radiographic guide. Then you scan the patient with that dual scan technique. We go through a treatment plan and send out a surgical guide. So it's pretty straightforward. There's not a lot of steps to it. Basic rules of using the guide, though, if you don't want to use a radiographic guide. And that's dentition supported. If you don't have a lot of noise, then it's, I would do the stone model route. But a radiographic guide is recommended, but again, not always needed. If it's tissue supported, then you want to get a radiographic guide, especially for the restorative aspect. And bone supported, you don't really need a guide. In some cases, it's recommended, but if you're just going to do a bone supported guide, whether you use a bone reduction guide or you just use the natural bone, you don't really need a guide for that case. So this is something we've had a lot of requests for some type of book or manual. So this is a book that we've made, and it goes over the first couple of chapters. Will go over how to use the Blue Sky software program to just a few clicks, and you can have a patient presentation really professional, and you can show them the 3D view, and you don't have to learn the software. Just step by step, it shows you how to do that. And then a basic placing a virtual implant. It won't go over for those of you who've treatment planned with me, you'll know that as we're planning the implants, I'm clicking a million different things and changing transparencies, and I do a lot of stuff. This will go over the basics. It won't go over the advanced stuff that I do. And the rest of the book really is just a written information about what I've covered tonight in this lecture. And then it goes over details in immediate temporization, radiographic guide fabrication, and then some didactic stuff. And then we have a pretty extensive glossary at the end. So if you're interested in this, let me know. Right now we've had a lot of requests, so it's on back order. But if you do want one, let us know. We'll put you on a list. They're $50, so they're pretty nice. Okay, so as I said in the beginning, we don't do just this guide. There's definitely support behind that. And you can have full support where you never touch your computer and we treat and plan the whole case with you guys. Or you have limited support where those who like computers and it's more efficient for you to do it on your own, then we support you with that as well. You have the software and the computer treat plan that way. So you could do, either way. So our basic process, what we do for you guys, is we do your data conversion, and then we have our 1 hour software support. You can use it or not. Usually doesn't take any more than an hour to go through. And then we have these surgical and restorative reports, and then we fabricate your surgical guide. And we do it all instead of charging per implant, because it's a process, we don't focus on the guide, we focus on the entire process. And so we just do a flat rate for that. And then we do have, if you want everything except for the surgical guide, we have a setup for that as well, just for the consulting aspect of it. And so I want to thank you guys all for coming out again tonight. I really appreciate it. I hope that this was staying with those basic fundamentals for all of your different cases. If you have a case coming up, don't hesitate to call. We can kind of discuss what's the best method and how to approach it and get started on it. My number, you can reach me directly at 760-274-4080, or you can email me. I'm pretty good at returning those as well. It's info@informationdental.com. So I'm going to turn it back to Michael. If you guys have any questions, let me know. We'll field some questions.
If anybody has any questions, they can enter into the chat box on the bottom right of this screen. To address a couple of questions that came in during the presentation, the Blue Sky Plan software is compatible with DICOM images from all CT scanners. As Cindy explained, DICOM is industry format, and uncompressed DICOM images can be loaded directly into the Blue Sky Plan software. What you want to request is uncompressed multi-file DICOM images, and those could be loaded directly into the software. Cindy, a question that just came in is, what is the turnaround time for surgical templates?
It's about 5 to 7 business days for the surgical guide.
Okay. To reiterate some points that were mentioned at the beginning, the CE credits should arrive within 1 week via email. We should have a recording of the presentation available on our website, blueskybio.com, and information regarding the webinar content is available at informationdental.com and blueskybio.com. There's relevant information and documentation there. If anybody's interested in receiving a better version, they could email us at Cindy, another question that just came in is if you offer surgical templates that can be used with pilot drills and final drills.
Yes, that's a great question. So our surgical guides, we can design around any type of template. So whether it's just for a pilot drill or just for a final drill, or you want either a pilot or a final, we can do that. Also, any type of system that you're using, whether it's the Zimmer or 3i, the Navigator, any of those type of systems, we can design the surgical guide to fit those. So you don't need to buy more instrumentation. You can use what you have in your office, and we design it on that. If you do need instrumentation, we can help provide that for you as well. So whatever your clinical needs are, we design the surgical guide around that.
Look, I'd also like to point out that the software could be used with all implant systems, and surgical guides could be manufactured for all implant systems. We definitely do encourage that you check out the Blue Sky Bio implants, including our most recent edition, the Nobel Active compatible implants. You could see all that information at blueskybio.com. Cindy, another question that just came in is if you could give some indication regarding pricing of surgical guides.
Sure. The surgical guide is a flat rate. It's $375, and that's any number of implant, and that's any style of surgical guide, whether it's bone-supported, tissue-supported, or dentition-supported. And that also includes the software support. You get surgical and restorative comprehensive reports. So that includes the entire process. Also training of any CT staff and training for radiographic guide fabrication as well. So.
And to address another question that just came in, the guides control the angulation, the location, and the depth. So depth control, depending on the drill system, the depth control is controlled in the surgical templates as well. And yes, the guides are compatible with all implant systems, including BioHorizons implant systems.
Yeah, and the drilling depths we can set. We have flexibility as far as the anatomy allows us to set the drilling depths to a certain height. And so if you do have guided surgery drills that have stops on them. We can set the surgical guide to that height so you bottom out. If not, what we do is we set the guides to seat as low, the drilling depth to be as low as possible, and then we'll provide those depths for you. So you'll either know exactly how many millimeters you have to drill down from the top of the guide to the bottom of the osteotomy, or we'll design it around your existing drill kit.
Cindy, a question just came in regarding slice thickness. What's the ideal slice thickness that should be requested from the scan center?
So the slice thickness, the scan center, what they do is they provide, when they give you the DICOM, that's the entire scan. And then you do the slice thickness on your computer in the software. And the standard is a 1 millimeter thick cut slice. So it's not something that you have to request from a scan center, but as we're treatment planning, if we're looking at 1 millimeter, sometimes we'll switch over to 0.5 millimeter or 2 millimeters, depending on the anatomy that we're looking at. So as far as the slicing and looking at the anatomy and going through the DICOM, we have the flexibility to be able to look at it in any dimension that we want to. So it's not left up to the scan site what they provide you.
Okay, I think that pretty much wraps things up. I want to thank Cindy for this informative and wonderful presentation. If there's any additional questions, Cindy could be contacted at info@informationdental.com and the phone number that appears on the screen. I can be contacted at plan@blueskybio.com, and please check our websites, informationdental.com and blueskybio.com.